Welcome to everybody else that I saw there. So this first little video is just really what a lot of this today is about, is thanking everybody for being a part of things. So welcome to our final meeting. I was saying how it's bittersweet. It's exciting. This has been a lot and very exciting, but it's nice to kind of just relax, exhale for a moment. So we are very thankful that you're here. Very thankful that if it's your first time, that's great. We want you to hear about veterans and hear about all of the accomplishments of this program. If you've been here before, thank you for being here. As Jennifer said, please put your name, your title, your organization, and your email into the chat. And myself, Wendy Elmo, Jennifer Raymond, and Paula Denslow would like to welcome you. We are your hosts from BrainLinks, and we'd love to have activity in the chat. It's been really exciting to see over time how connections are often made, how people say, hey, I want to get together with you. I want to chat with you offline. And that's been really great. So if you want to share anything related to your work and veterans, that would be great. And also any changes that you've made because of the TBF program, that you learned something about maybe mental health and you've implemented that into your program, whatever it is, please share it with us. We'd love to hear about it. So today is going to be a little bit different. I just have a couple of updates. I'm going to give you a little bit of information about brain injury and veterans. And then we have our guest speaker, Kate Gladue, here. She's going to talk about veterans. She's going to do it in a little bit more of an abbreviated form than sometimes we do, but you'll have her information. If any questions come up that you don't get Kate to answer, you can either reach out to her, or in the resource pages, you're going to see people that she's also, or groups that she's also suggesting that we go to. So take a look there as well for some other resources. Then we'll have some questions, and then we're going to share about the accomplishments and the impact of Tennessee Brighter Futures that you all have been a part of. We really want to share that with you because this has been having to wrap up, has really been a good experience because we've had to take a look at what we really accomplished, and it was much more than we ever thought of when we set out to put this program together. And then we have a survey at the end on the overall program that we'd love for you to fill out for us. So housekeeping, you have received the child resource pages. If you don't have them, you can either reach out to us or go right to that link on the Tennessee Brighter Futures web pages and find them. But if you go from Jen's, you can forward them on and keep on spreading all of the news that comes from Tennessee Brighter Futures. And then this is from the actual email, and it also has the impact survey in there. So you may have already finished it. So veterans and brain injury. So most traumatic brain injuries among veterans are from explosions and from combat. And PTSD often occurs along with traumatic brain injury in veterans because of the traumatic event caused it. We can see that in civilians too, because anything that causes a traumatic brain injury, whether it's a fall down the stairs or a car accident or anything, can stay with the person as a post-traumatic stress event. There were 414,000 military members diagnosed with TBI from 2000 to 2019. Most were mild. We do know, though, that mild injury doesn't mean mild outcome, just like severe injury doesn't necessarily mean severe outcome. So with a mild injury, you could have significant changes to your life and to the way you think and to your ability to perform the same job that you used to do beforehand. The service members have higher rates of traumatic brain injuries. They have higher rates of not traumatic brain injuries, but of with TBIs have higher rates of PTSD, depressive disorder, substance use disorder, and anxiety disorder than those without a traumatic brain injury. And 84% of veterans with a mild injury have had greater combat exposure. Um, Trying to grab this out of my way. Less social support, more comorbidities, things like asthma, PTSD, sleeping problems, worse pain scores, and slower processing speed. Um, and keep in mind too that this right here, this is what we know the most about traumatic brain injuries, but veterans, like the rest of us, can also have non-traumatic events like things like stroke or brain tumors, brain infections, things like that. So brain injury can affect them in other ways. So some common problems that we see after brain injury, and this is not just veterans, but on anybody who's had an injury, we might see cognitive things like attention and memory and new learning changes, slowed processing speed, organization and problem solving issues, impulsivity. We might see more behavioral or emotional things like irritability, frustration, agitation. We see physical things like balance and dizziness and headaches. And poor awareness of deficits and difficulties is a very common occurrence after a brain injury. Not so much with mild injuries, but more with the moderate to severe. So when I worked in a hospital working with people with brain injury, often the first thing I had to work on them with was their awareness, really realizing that they even have any changes. Um, we might also see other executive functioning things like difficulty being flexible or being able to monitor what they're doing and how they do it and making change based on that. So what we would do with veterans is what we would do with other populations is to screen for a history of brain injury, assess their cognitive and functional impairment, educate staff, educate the veteran about their own brain injury and their family too, provide and teach accommodations, hopefully within that system that they're in, and then connect with community resources if that was appropriate, or other resources even within the VA system. And so, with that little bit of an introduction, I now want to introduce Kate Gladue, the local recovery coordinator for the Tennessee Valley Healthcare System of the U.S. Department of Veteran Affairs, to take things over and give us some information about veterans issues. And I'm going to stop sharing, and Jen is going to take over the share. And then we will let Kate get going. And thanks for being here, Kate. Thank you very much.
You're welcome. My pleasure. Okay, y'all can hear me?
Perfectly.
Yes.
Okay, wonderful. Thank you. Well, thanks for introducing me, Wendy. Again, my name is Kate Gladue. I am now the local recovery coordinator at Tennessee Valley Healthcare System. Been with the VA now 10 years. I learned something new probably by the hour, if not by the minute. And so I am going to share just kind of hopefully an overview of VA, and then also a lot of resources, because there's just so much the VA can provide, and want to make sure that I give you awareness as well as some education in that. And so this will be kind of broad, a lot on just VA in general, and then as well as local to here at Tennessee. So next slide, please. So to think about the Department of Veteran Affairs, there's actually only three major departments. There's the Veteran Benefit Administration, so that's the VBA. We use acronyms for everything. And then there's Veteran Health Administration, that's VHA. That's where I'm employed. So that is your hospitals and your clinics. And then there's the National Cemetery Administration. Probably the one that is most smooth and why I won't do much presentation on it is the National Cemetery Administration. And so that one luckily has a lot more, just a smoother process to find out information, local contacts, and again is a very strong program within the VA. And so I'll dive into a little bit of the VBA and mostly on the VHA in this presentation. Next slide. So to break it down, what is the veteran benefits? I want you to think of things like anything outside of health. And so that could be compensation, pension, even applying for a home loan. We have unique things, even like a small business loan for veterans. There is the employment support, there's education and GI bills, vocational rehabilitation, life insurance, just all the things that you can think of that kind of have that a staple of benefits all goes through the VBA. So a very strong program. There has been some changes recently just with the government shutdown and kind of freeze. So just awareness on that right now. But as far as in my world, which is the VHA, that is a very protective that again, as a nation, we really are aware that health is a priority, and so are our veterans. So that is, in my 10 years, has never been impacted by any kind of change with government. So I'm lucky for that. And so when you think about the health, think about again what you get. So your doctor visits, your primary care, as well as even a bigger opportunity for things like mental health, specialty care. One of the coolest things I always tell people about the VA is it's one system. And that is very rare and unique that you can have all of your services all in house, all connected to one system and one location potentially. It's big here in Tennessee. Uh, Locally, we have two hospitals. One in Nashville and Murfreesboro, and then we have 22 clinics. So I'll get more into that, but just as a small example of how big and widespread health services can be for our veterans. And then, like I said, the cemetery, the NCA, again, is a beautiful way to honor veterans as well as their families. Some people don't know that, but it does allow for families final resting, commemoration services to really replicate and honor the sacrifice they made. So, wanted you to know kind of those are the three pillars of the VH or the VA. Next slide, please. So one of the first questions I tend to get is about education. I think that again, that's a growing, bigger topic, which is wonderful, and is something that is a value to our veterans. And so, the best way to kind of think about education is no different than when you would be applying for a university or state school or anything that you'd want training in. It usually starts with a phone number, if you're lucky, but more so a website. And so you're going to see a lot of websites in my presentation. They're also just going to provide the most up to date for when phone numbers might change or better connections. So GI benefits, education and career counseling, dependence education assistance. That's something a lot of people aren't aware of. There could be definitely regulations on who is eligible for all these different things, but it can be a pretty clear cut once you go into the website or give the phone number a call on figuring out where you're eligible. We have readiness and employment as well, so that is also somewhat of a newer program, and that kind of again is opening doors to employment because that's the biggest challenge for a lot of veterans. They had their employment when they were active, and when they become a veteran, it means they're no longer active and they don't have that full time job and that full time career that they had when they were in service. So that's kind of where I want to start is making sure that everyone is aware that there is education and employment support. Next slide. And thank you, Jennifer, for doing my slides. I appreciate it. Another big question I get is about the compensation, about how veterans will earn different compensation for illness, for injury related to health that occurred when they were in service. This could be physical injuries, it could be brain injuries, as Wendy kind of shared the statistics on that earlier. It may also be mental health conditions. It could also be conditions that maybe fully didn't present in service, but that you can kind of look back and see the connection on how it started or maybe how it escalated. It can be a very complicated process. The best news that I can give you is that you don't have to do it alone. And so we have, it's nationwide through the VBA, as well as different counties. So that would be like what we call a veteran service officer, that these are jobs everywhere for someone to walk you through and work with you on your disability claim. That is the one big thing I'll tell veterans. It may be honorable, and I respect if they think they can fill out that 75-page paper themselves. But if they have a free agent, which is kind of acting, I don't want to say like as a lawyer, but will definitely be able to be most knowledgeable in how to file the claims, what the paperwork means, explain the process. I see a lot of benefits for veterans. When they do work with someone they can trust. And the majority, I can't say on the percentage, but the majority of those staff members in those jobs are also veterans themselves. And so this again could be a very easy thing to look into on where the VSO is in someone's county, as well as setting up an appointment again with a VBA office. Again, could be currently a little bit of a delay on getting those appointments, just how things are right now. But big picture is if there is questions on disability compensation, there is staff members employed by the VA to answer that. Um, Next slide. Okay. Another big question I will get is, well, who gets to go to the VA? I always share that I feel very honored that I got to get my own grandfather enrolled at the VA. He was 72 when I was hired at the VA. He's not a combat veteran. He served in the Army active for 2 years and the reserves for 8 years. And he felt that he wasn't material for the VA and that other veterans deserved it more than he did. And so I got to explain to him that it was for veterans, all veterans, the majority. I'll explain kind of the limits of criteria. But the more veterans that come into the VA, the bigger the VA gets. And to really kind of let him know that we wanted to support him. And so, sure enough, I got him to go, and he ended up really liking his primary care doctor, and made my work feel that much better that he finally enrolled and then told some of his friends who were also veterans about it. So that's something I always like to tell people, that there's probably a lot of veterans that are not getting access to care they would qualify for. It does depend on their discharge. So I wrote it in red. That's called the DD 214. So that is their discharge paperwork. And so it will show pretty much like a snapshot of their name, what branch they were in, where their first duty station was, if they got any awards or medals, when they enlisted, the date they discharged, and then it also shows the criteria of discharge. And so, with the VA being a federal system, the way they accept healthcare is based on how long they served. So, it can range from, again, if they were reserves or active, a certain number of months or days. It is a little specific, so I can't give a general number, but it is rated. So, if you only joined the service maybe for 2 days and then decided it wasn't for you, you may not be eligible then to get health care. And I say that may not, because there is certain things that might allow you to get it. Service connected disability ratings. So that definitely can play if you've already been established with disability ratings. That's an automatic into the VA. Um, Recipient of a Purple Heart or being a POW. Combat veterans. especially within the last 10 years. That was a big push with post 9/11. And so there's just been, again, ongoing changes to expand eligibility. I can at least tell you that. There's never been shrinkage of eligibility, it's always been expansion. And so it's always something, even if you feel maybe 10 years ago you did not, you were told you weren't eligible, it may be different now. May change also with your eligibility for things like Medicaid, as well as income. You can also fall into, once you are enrolled in the VA, about 8 different categories of different enrollment. And so that could even be copays or not copays, things like that. So it can get a little complicated, but it's good to know that you'll be able to apply. I'll share that on the next slide and then find out where you fit. Both cases, family members are not eligible for direct health care, like for a family member to have a primary care doctor as well at the VA. But there is a small threshold. Again, you could find that out through something called CHAMP VA. It is rare. So when you want to kind of know about those priority groups, again, websites can really spell it all out for you. And I put that in the chat for you to kind of know. Your income could also change. I see that commonly with veterans once they retire and maybe switch to their pension, their income level can change, or separation of family. So it's always helpful to also educate veterans to say, hey, if your eligibility changes, you can always update that, and that might be financially supportive to you. I put in yellow again because I told you eligibility has only expanded, that there is never a cost for any veteran that comes to the VA requesting support for military sexual trauma. So that's a unique acronym that we only use because it's relevant to the military. And military sexual trauma can be a widespread understanding of trauma, from physical to verbal to sexual to implications, to harassment. And so, if any veteran is feeling that they have experienced that, there's never a cost, and it won't be reflective on, again, that discharge of their income and things like that. And so, there's just something always to kind of explore, that eligibility is expanding. Next slide, please. Three ways to enroll. So you can go in person if you know where your VA location is, a hospital or a clinic. You can walk in the doors. The people in red polos are what we call VA ambassadors, and they are the ones that can kind of help direct on, say, a veteran's looking for where the MRI clinic is for a brain scan he's having today, or where the pharmacy is. So should put that in a slide. But just know that when you walk in, it can be intimidating. If you can see a staff member, we do a good job. I led a veteran this morning when I was at the hospital to the area for the dental clinic. So you can go in person. You can fill out the form and then find out. It is good to bring a copy of that DD 214 because they'll ask, and then you'll have to go home and get it and come back. So sometimes an easier way is just to apply online, um, and it can be pretty quick, as well as over the phone. Um, I wrote in red because the first thing that you're going to do, they're going to do it automatically for you, but it's also for your awareness on what the next step is that you'll be assigned a primary care provider. That's the gold, and um, that's the director, the cruise director of all your healthcare needs. And so every veteran that's enrolled in any healthcare facility has a primary care provider, and then everything kind of reroutes and channels through that primary care provider for a lot of the consults and referrals. It's usually about a standard of an annual visit with your primary care doctor. So that's something to kind of think of and expect. You can also see them more often than that, and then you can get more services. But I will work with a lot of veterans that might get care Like my grandfather, he would get care through his insurance in different ways. And so you can get dual, that's also very unique, but you could get health care both through the VA as well as your own private insurance. There's not a, you don't have to choose one or the other. And then also with eligibility and billing and insurance, there's some navigation on how that kind of looks. But just to give you that example, my grandfather would go once a year to his primary care doctor at the VA and almost like a second opinion, or just maybe even learn what other services he might get through the VA the primary care doctor thought would be helpful. And so he was able to kind of balance that communication. So that's how I like to describe how to enroll. Take whatever way you're comfortable with, in person, online, or over the phone. Get in the door, find out what your eligibility is, and then you'll get started with a primary care doctor. Hopefully, that's again less intimidating. Next slide, please. Luckily, another thing that we've added besides the primary care doctor, we've added what we call the M2VA program. So the M2VA is our acronym for Military to VA. The understanding that it is still going to be intimidating. It's a restart to a whole new program. And so you will actually get a personal case manager that welcomes you to the VA, answers all your questions, and kind of serves as that a voice and support system for any transitioning service members. So I did put the numbers on here. So these are all great numbers to have, or to kind of again know that they exist. Is that Tennessee Valley? That's again here locally, and then Mountain Home is out in Johnson City, so Eastern Tennessee, and then Memphis VA Medical Center. So those are our three main medical centers in Tennessee, and know that they're very helpful. And you can kind of even see the word polytrauma, which I'll kind of jump into later in the presentation. That's in relation to brain injury. And so that's kind of our term for brain injury in the VA. But you can see an advocate, you can see case managers, you can see social workers. That again, the military to VA program. Can't say when it started. Perhaps in the last 10 to 15 years. I know it was a lot more related to post 9/11 and such the increase of veterans enrolling in the VA, but a very helpful option. Next slide. So besides primary care, what other services? I could probably spend an hour on all the services if I could even tap into all of them. But I'd like to give you kind of an overlook. Services besides primary care can be mental health, preventative care, specialty care, again, your pharmacy, women's health, geriatrics, palliative care. Um, uh, just ongoing with different mental health support systems, as well as care in the community. Veteran now have caregiver support programs. That's been, again, an expanding program for family members. Although they can't get, like I said, the health care primary care doctor, but a veteran spouse might be getting a lot more support than they might realize. And so that's an offer. We have chaplain services and then polytrauma services, which I'll kind of dive into, being that this might be an interesting topic for many of you. Next slide. So, what is our policy? So, the VA has taken on what we call whole health. And the way to think about whole health is just more of a patient-centered approach. That again, for a while we did more. That maybe make sure I said it right. Person-centered, not patient-centered. And so, for a while, it was patient-centered. That was what was understood. The doctor's the expert, the patient is there just to talk about their problems, and the doctor tells them what to do. Well, person centered is now there's two experts in the room: the person that knows everything going on with them, the human, and then the provider that can be there to support, meet them halfway, and empower the health and the well being. So you can see the question from what's the matter with you to what matters to you, to really take a bigger look at, instead of just focusing on smoking cessation, right? Of just how do we get someone to quit smoking? Well, it'd be probably more helpful to understand what their values are, and perhaps it's more travel and visit with their family, or spending more time outside or getting back into hiking, which then could relate then to health and improving health and decreasing things like maybe blood pressure and a risk of heart disease. So it's just a different approach that's now being implemented across everyone at the VA. So this is not just to the providers, but also even to the assistants and to the schedulers and anyone that you see at the VA. So anything from health coaching, self-care strategies, again, expanding a lot more on holistic and well-being programs. The VA is now able to hire chiropractors, yoga teachers, Tai Chi teachers. Just it's just expanded, that it's seen now as what is the choice you have for your recovery and your health, and how can we offer and find that for you. And so again, something that I think that well-being program is, I would probably have like 6 more slides here in the next couple years. I'm seeing things like equine therapy with horses. A lot more stuff with art and music. So it's definitely expanding, and it's really wonderful to see. Next slide, please. So, what could be some mental health services, and what would the need be, and what would it look like? So, I am the local recovery coordinator, so this is a little bit more in my wheelhouse to educate more on mental health and recovery. And there's a lot of common conditions. Moral injury, again, is more of a unique term here in the military, to understand how military principles can kind of impact your morals and values as a civilian, and then maybe even that transition into civilian life and as a veteran again. The moral injury can also happen in other occupations like firefighters, police, EMS. So, and kind of understand again how just different settings of a work environment can lead to impacting things like moral injury. Very well aware of PTSD. Part of the word has also been decided to maybe be removed. That's still up in discussion, to transition to just post traumatic stress. As I explained before, what MST, military sexual trauma, is. And then, of course, depression, anxiety, substance use, thoughts of suicide, grief. That is something that not a lot of folks think of, but we've all experienced grief. And perhaps as veterans, there's been different layers to that. And then again, if you're going to be enrolled at the VA and hopefully the rest of your life, there's probably going to be times you experience grief. So knowing that that is also treatment at the VA. Severe mental illness, that's a personal passion of mine. That's an area that I specialize in. And again, we may not always realize that it can impact our veterans. Veterans often enlist at age maybe 17 or 18. Often at the age before, a lot of those symptoms may arise. So, symptoms with psychosis, schizophrenia, bipolar disorder. Um, that's what we're here for. And we have very good specialty care. VA is strong on research based. We do not implement anything that does not have sometimes decades of research backing it up. And then we follow through. So we have a lot of standards that when we do certain types of therapy that we have to meet. It's can be extremely structured, which can be intimidating to some, but others it may feel that you're going to get the best of the best. And so I made a list there, which again I could talk to you on quite a lot. As you can see, the bottom bullet point says "and more." Again, that list is growing. So it's just something to know that if you are looking for that specialty care, the VA is who can provide it for mental health. And it can range from being inpatient to outpatient to even residential. And again, the task is to find what fits and works best for you. Next slide.
Um, Kate, I'm going to ask you a question from our chat.
Sure,
It
sure,
seems like it's going to be a good fit right now before we keep going.
sure.
Yeah, thank you. This is from Marcy, and her question is M2VA only for newly transitioned military members, or are current veterans enrolled in this? If so, how? And she has a little bit more here. Tracking all things, appointments, updates is a lot, especially for someone with a TBI. Is the caregiver support program the only way for a spouse or a family member to have access to our warriors' appointments and VA communication?
Thank you. So the first question is yes, M2VA is for only newly transitioning veterans. If there is a veteran already enrolled in the VA, then that would not apply to them. It's all veterans that are outside of the VA coming in. Access to medical records, appointments, the best thing is through the My Healthy Vet portal that has changed here recently. Now you have to have a Gov ID me kind of but if you can set that up, again, you're welcome to email me and I can give you the link. If I don't think it's in my slides, um, but then you have kind of like you would in a private, like through your own insurance, with your own medical provider. It's the same concept that you can message your provider, see where all your appointments are, and then it is 3 business days. That is the standard protocol for anytime you message a provider of how soon they have to respond. And so I understand that it can be tough with the calling of the phone line, being on wait, not being connected to the right person, but that online portal is the best thing for you. So if you're part of that online portal, if your veteran grants you permission with their username and password, you would not have to be part of the caregiver program for that. Okay.
Thanks for your question, Marcy.
Yeah,
And let me make sure I got you back on the right slide, Kate.
sure. I think we're on 12.
Very good. Thank you.
Yeah, thank you. And so kind of jumping on to the new standard of care, which is recovery oriented, and that's my title. I'm the recovery coordinator. So it's really understanding the empowerment to veterans to take charge of their life, their treatment. They're focusing on their strengths and making sure we give the utmost respect, honor, and hope to our nation's heroes and their families. There's a great video, if we have time for, that we'll be able to watch here at the end. Next slide. A little nugget that I like to, there's probably because I worked at one, I can't not share it, is our vet centers. So our vet centers are part of the VHA, but they do operate differently. So I remember when I said that a DD 214 on the disability rating, income, all those kinds of things, the eligibility is very different here. At a vet center, it's only for combat veterans or veterans that have experienced MST regardless of income, discharge, anything at all. It's a tiny little shop, could be anywhere from 3 to 10 counselors. Majority of them are veterans themselves that are there to do counseling. They're called readjustment counselors. So I like to at least let folks know it can often be the combat veterans and veterans with MST that are most resistant to going to the VA. This is a lot less intimidating. This is an ability just to walk into a small center where everyone there is going to understand and get started. And it's a very strong program. Like I said, I'd like to make sure I let folks know. And if you call your local vet center, they will answer and share all the information and more that I just did. You can go to the next slide. Again, some helpful resources to know is that we do have an intimate partner violence assistance program. So we have a national hotline as well as a Tennessee state hotline. So again, knowing that those hotlines are available. We have a veteran crisis line. You all are probably already familiar with the 988. Thank goodness we have that number now. And then the ability to press 1. It's 24 hours by pressing 1 to 988 is specific for veterans. There's also a text number, which is very user friendly, as well as a chat online. VA Emergency Department Finder, I think, is also very helpful. You can also go to an ER if it's not the VA. So, say you're traveling, you can't find your local VA, you are a veteran enrolled in the VA, you can go to any ER. You just have to make sure you communicate with that ER that you're part of the VA for insurance and coverage and things like that. That's also somewhat new. Big phone number to know is the homeless veteran hotline. It will reconnect you. So even calling that 1877 number, it will find the local facility. Same with the 988 press 1. And so that's what happens is you call that general number. They will do what they can to help you, and then they will streamline it to your local facility, and then we'll get that message and then be able to pursue from there. Okay. Next slide. Few questions that you had without probably me having time to really dive into it. More on that caregiver support program. That's the general number. Again, then they would be able to streamline to the local. That's got a lot of different eligibility and service opportunities. So that's where to start. And so just kind of understanding, talking to someone to kind of know your unique situation to help navigate where you can get support. And so I actually put that number twice because I do think it's really important to have. Um, and again, we'll kind of streamline for you. It's a great program, also growing. You can go to the next slide. Okay, so again, with kind of understanding how VA operates might be different than some other programs. We identify brain injury as polytrauma. So it's injuries that are sustained. They might be life-threatening, or they might be, as Wendy kind of shared, more minor, but still having impacting symptoms. And then it's wraparound services. So there's an interdisciplinary care and support for veterans that have experienced brain injury. Again, nationwide, it could range from outpatient to residential to inpatient, different specialty. So I can share again how this is a growing service line, and luckily we do have one at Tennessee Valley. So next slide. So to know kind of, again, the contact information for our local facilities, these are the two main hospitals. So we have both the one in Murfreesboro as well as the one in Nashville. And then we have 21 clinics. We do range across the state. Even with some of our clinics in Tennessee and Kentucky, we might even have veterans coming in from Alabama and Georgia. Again, it just depends on the proximity they are and as well as their preference. And so that's kind of the best way to kind of navigate and then know. I couldn't do an entire additional presentation on understanding community care, and that might be something you all have heard of as well. So veterans that are in a rural area that it's still going to be a few hours to get to a nearest clinic, they may be eligible for community care, where then the VA is paying and covers for them to find the primary care doctor that's closer to them in their home. And could also be a waiting time. So if you're really looking for a sleep study and your current VA has too long of a wait time, that also may be eligible for community care. So there's a couple more layers with that, but I always like to at least inform people that that is still potentially an available service. Okay. Great. Well, I tried to keep it as close to time for you all, but like I said, there could be a lot more to learn about the VA. Hopefully, that's a good starting point. And if we have time, Jennifer, feel free to do the video, and then if there's any more questions you'd like for me to answer, I'm ready.
Super. I'll get that pulled up. If anybody has any questions, you can put them in the chat, or you're welcome to come off mute and just speak for a moment while I'm getting this sharing done.
Hi, folks. This is Paula. I'm just going to follow up. Marcy tucked in another, she's shared a website, and she said it's psycharmor.org. Does a great job of helping our leaders, trainers, family members, and neighbors have a deeper understanding of how to relate to our warriors and our families. Free webinars, the CEO is a friend and a superhero fighting for our veterans and veteran families. That's really awesome, Marcy.
Yeah, thank you, Marcy, for sharing. I do think it's a great resource.
It is. Tina's the bomb if you know her. But
Don't.
yeah. Meet her. You'll know all the other veteran everybody's if you ever
I
get to
bet. Very cool.
But anyway, just on that note, thank you guys for all the work that you're doing out there. And Wendy, whatever you stated in the beginning, welcome to my marriage. Welcome to my house. Welcome to all the hard. So, but yeah, I mean, the VA is ginormous. You know, I know you guys are out there doing the best you can. So I just thank you for all of it and but also just continue whatever education we can simplify for the families and the children and the siblings and all the things. So,
Absolutely.
because especially folks with TBI, for all the reasons Wendy mentioned on the front side, you know, it makes it very, very hard. They don't want to feel broken. They don't want to feel all the things. So we got to continue to figure out ways to make all these resources accessible to the folks that are trying to advocate for them.
Yes.
Okay. Thank you. Thank you, Marcy. We could still have some more questions too, and love your input as we go. We're going to watch this 2-minute video that Kate has for us, and let me know if there's any trouble with the sound, but it should be working well.
You're a veteran, family member, or friend of a veteran facing a mental health challenge. You are not alone. No matter where you are on your mental health journey, support is available. MakeTheConnection.net is an online resource that connects veterans, their family, and friends with information, resources, and solutions to mental health challenges and well-being. Hundreds of veterans have shared their stories of mental health treatment and recovery. These are stories from veterans for veterans. Hear candid accounts from veterans to learn how they recognize their mental health signs, symptoms, and conditions, and how they reached out for support.
I felt as if it was my duty to heal myself. You know, I said, if you're brave enough to serve, you're brave enough to heal.
I think the biggest gift I got from taking the risk and seeking treatment is joy.
Find a story that resonates with you in just a few clicks. Easily filter veteran stories by service era, military branch, and combat experience. Or find videos by topic, like PTSD, transitioning from service, or stress and anxiety.
I came to the realization that I was carrying all these burdens of shame and guilt of what I did in combat when I didn't have to.
If you're looking for support, MakeTheConnection.net can also connect you with mental health resources, tools, and programs online and in your community.
The mission is no longer counterterrorism. The mission's you.
There's so many more things left in life for us to do.
You have to put yourself first. You have to talk to somebody.
Every day, veterans and their family members find support and get on a path to a more fulfilling life. You can too. Visit MakeTheConnection.net to get started.
Okay, great.
Thank you, Jennifer. I put that website in the chat. They're very brief videos, could only be like maybe 2 to 6 minutes. It's just another starting point. I agree that it does normally take finding someone you trust to bring you into the system, and may not just be that video. It often is, another veteran or someone, a loved one. Again, been many family members that have been able to get their veterans, like my own grandfather, into the system. But I do think it's a helpful place to start. And I did put my contact information in there, so you're welcome to reach out for more questions.
That last one, Make the Connection, really looks like a great resource. Really, really cool bank of videos. So you can continue to put any questions that you have for Kate into the chat. We're going to move on. Kate, thank you so much. That has helped me so much to understand the system a whole lot better. It's a complicated one for me.
Yes.
I'm gonna share now and take us the rest of the way. And if we have time at the end and there's more questions for Kate, we'll give them to her. Okay, so you will get from Jennifer in the next few days, maybe early next week, you'll get the brain injury and veterans infographic, and this has Kate's blessing on it. And you'll also get the resource pages. So you might want to go over to the website, the Tennessee Brighter Futures website, and download Kate's PowerPoint because it has so much good stuff in it. Some, if not all, will also be in the resource pages. So you might just want to kind of have both of those and combine them. The infographics, now that this was our last meeting, they're all now available, not just one by the system of support, but they're also available in one PDF. So you can download them and have them all together. And then same thing with the resource pages. So all of the resource pages are just all in one. So you could just get them out to frontline providers so they have the information they need and they know where to be sending people. So all of them are now available, and we're really excited about them. So our dream in starting Tennessee Brighter Futures was, our BrainLinks dream was initially for everyone to know about brain injury, all of the different support systems to know, here's what brain injury is, and here's how we are connected to your system. And then when we continued to dig into research and continued to think about all of the comorbidities that go along with brain injury, we realized that not only did we needed to know that we wanted you all to know about ours, but if you were really going to treat our folks with brain injury in the best way, if you were in mental health, you also needed to know about domestic violence and chronic pain and all these other things that go along with it. And then we realized that, well, we all need that. Brain injury needs to know about all that you do, so that if we're all going to best serve the people, all of the people out there with anything, we all need to know more about each other. And that's where Tennessee Brighter Futures came along. And so we used this, I call it the flower for the Tennessee Brighter Futures logo, but really, if you dig into it, that's on the left there, that's what it should look like. This was on my dining room table with a bunch of sticky notes and butcher paper to try to get my head around what does that look like when everybody is connected to everybody? And that's what we've tried to do here, is to have us all know, how do these systems work and who are the people, what are the resources? And so that was our dream. And the mission was to build brighter futures for Tennesseans by improving how systems systems of support collaborate to identify, educate, and serve people with co-occurring needs. And the shared commitment at the very beginning, people were they were signing on, and we were going out and saying, hey, could you be a part of this? Over time, there were a lot of people who wanted to join, and were like, come on in, come on in. But the shared commitment initially was, we're going to find ways to change our own systems. We're going to become a part of this bigger collaborative to learn how we can change our own systems. But we were also going to share our expert information with everyone else. And this was everybody's commitment, so that everybody could be learning what we all know as experts in our area. And we, as many of you know, we pulled together all of these major systems, and we pulled together 5 different social determinants of health. And so we had people from frontline providers through state level administrators to come to the table, but then in each of these areas. But then we also had some broad groups that didn't have just one specialty, like United Healthcare and the Tennessee Charitable Care Network. We pulled in those folks too, because we realized that they would need these resources. So that was just a little bit of background about the program. And now I want to dig into impact. And this, we thank all of you for helping this impact be as big as it is, and will continue to. It's only going to continue to grow as we continue to resources. So there have been over 590,000, we call them impacts. I'm going to dig into what that is in a moment. But this is so much bigger than we ever could have dreamed. And that's the power of harnessing this network. And we know that this number, first of all, it's going to go up because we're going to share all of Kate's veterans resources, and hopefully you will as well, with anybody that you know that needs that information. But also because we know that there's been a ripple, and there have been lots of things that we've stumbled upon where people have shared and we didn't know it was there. So we know it's much bigger than this, and this to us just blew us away. So some of the specific outcomes, the information, including those infographics and the resource pages that I talked about, the videos, because this is recorded today and all of the meetings were recorded. Those things were shared via email, newsletters, conferences, team meetings. Sometimes teams gathered to watch the videos afterwards. Social media resources were permanently added to several newspapers, and I saw that LaDonna was here. And whether you were here or not, LaDonna, I was going to point out that the mental health resources, I'm glad you're here. The mental health resources have been added to the bottom of the Tennessee suicide prevention newsletter. And LaDonna, I love the way you've reorganized the bottom of that. It really looks cool. We do notice. So thank you for that. And and other newsletters. Resources were added to websites. Resources were requested to be added into other groups' training. So they'd say, hey, that was great. Can we use that? I'd say, absolutely. It's here to share. Our videos of the recordings of these meetings have been watched over 1,000 times, and we're expecting that to continue to grow as well. We think that some of that is happening because, first, they're awesome. Second, because we provide a certificate of attendance for watching. They're always built into any of the videos, like this one will be here today, so that you can come together as a team and you can watch it. And if you can use that certificate for obtaining continuing education credits, then it's there, and it's great information and a free way to potentially get CEUs. So we just love that. And we were initially worried, like sometimes when we didn't have a big meeting, we'd think, oh no, this is terrible. And then we'd see this huge jump in the videos, and we'd be like, all right, all good. We don't care if you're here. We love you here. But we just want you sharing the information and learning the information. We know that people with brain injury in other programs were referred to help. We know that because sometimes the programs told us, hey, we're referring to your service coordinators or to other groups within the state. And we also know that because our service coordinators have said we've gotten an increased referral in certain areas. So let me just add something to that. Our goal is not to have everybody that you identify with a brain injury referred to someone like our service coordinators. Our service coordinators, they are free. They are across the state. There's only, and I'm going to get this wrong, Ashley, because I know the number's been changing, but there's about 7. And they are free. They are regional, and they do a lot. So we can't refer everybody. Our goal is to help you learn what you need to be able to handle them within your program. Not doing brain injury treatment, but incorporating accommodations into your program to help them to thrive in your program. And we can help you to kind of learn more about that, as can some of our videos, not the ones from this group, but the ones that BrainLink has put on. It has been really fun to watch the chat and to see people connecting within the chat. So there's been meetings that have been arranged between other organizations. And again, that is the goal. Let's get connected across Tennessee. Let's make Tennessee a lot smaller in that sense. And we also know that programs began screening for brain injury. And of course, we're very excited about this. I talked about the infographic series. These are just some of them. To point out something about them. So these are brain injury and each area. You are welcome if you want to take this template, if it'll work for you, and maybe you come from mental health and you want mental health and substance abuse or substance use as an infographic, and you want mental health and domestic violence, run with it. That's awesome. We just took this upon ourselves to really have this one pager on brain injury and that area. And you'll also see on the whole thing looks very similar from one to another. We wanted that familiarity, but we also, especially when it comes to that first circle, the best practice, we wanted everyone to see that it's not magic. We want you to implement a simple process to make brain injury a part of your program, identifying people with brain injury. And again, those are available for download one by one or all together. This is the one that brings together brain injury and all of the co-occurring conditions. And we thought it was really powerful to just see on this, it's 6 pages, but on this front page to see how brain injury is connected to all of these different areas. And if you look at the numbers, they're huge. Brain injury has to be playing a role in these systems. We know that it is. Research tells us that it is. And then from there, we go on to give you a little bit about the numbers. We pull in ACEs, adverse childhood experiences, because ACEs change your brain. So we feel like you need to have some understanding of that as well. They were our very first speakers because we felt like ACEs were foundational to everybody's practice. And so you can go back and listen to that video as well and get those resource pages. And then the pages 3, 4, and 5 go into a little more depth on each of the areas and their connection to brain injury. And then that same protocol of those 3 circles and what do you do? What are you looking for? And this just gives you an idea of the resource pages if you haven't seen any of them in the past. And they give an overview of the area, and then they give the overlap with brain injury. And then they go into, there are 3 to 6 pages typically, and they go into things like what's the crisis. First thing is what's crisis care? Where do we go for that? Then screening for that area. Then there could be Tennessee websites, national websites, infographics, trainings, so we've given you an overview, but you want to learn more. Where do you go for that? And so there are some trainings on that, on each area listed as well. Sometimes support groups. It really depends. I love the disability health one is here. I loved Jen wrote this great little blurb on the history of the ADA for that one, because that one fit there. So if something popped up like that, then that would be included as well. So some more outcomes. We had a lot of national outcomes, and this was not anything that we were thinking of at the beginning. This was all how do we pull Tennessee together? How do we get a nice network across the state? And what happened was other states were watching, and we are connected to other groups nationally, as are you, and our uh, our resources started popping up across other states. And the TBF, the Tennessee Brighter Futures collaborative model, was shared at several conferences, including last week. Paula and I went to Portland, Maine, and we shared it at the National Association of State Head Injury Administrators Programs. And it was really fun because we had people coming up to us and saying, "Hey, we've incorporated." I'm going to show you a video that we made. We've incorporated your video into all of our crisis intervention training. That's for law enforcement. And I thought, that's a really good idea. I need to do that to ours too. Other people were saying how they were using them. They were incorporating other things, and they're using often the infographics as a discussion point with that other system. So they can walk into a homelessness system and say, "Hey, look here. Here's the key information of how we're connected to you. And by the way, we're very connected to you. You have a lot of our folks." And then incorporating the video, as I said. Our speakers, and I don't mean the brain injury speakers, but our speakers on other topic areas were asked to speak at other conferences. They'd say, "Hey, that was a really great talk. Can we have that person?" Like, "Yeah, we'll hook you up. We'll set you up with them, and you can pursue it from there." We know that one of our documents was used as support in a dementia grant. That was one of the brain injury documents. That was a brain health document. And that was a connection that came about because of Tennessee Brighter Futures. We fulfilled requests for additional brain injury trainings. We had a lot of requests. That was not our goal. Certainly, we wanted people to be trained in brain injury, but we knew that it had the potential to overwhelm us. We're just 3 people here trying to spread the word and help people out to learn more about brain injury. But so what we did was we created training series each year. We had a training series. So we had 9 different trainings, or we will have had. And instead of training for 10 people in a department or 30 people, now we had 200 to 400 people showing up for the trainings. So that was really exciting for us. They're great trainings, in my humble opinion, to go back and watch. You can share them with staff. The first year, we had 4 of them. And the first one was on brain injury and concussion, just information about that. The second one was on cognition and accommodations. And then the third one was on psychosocial and behavioral changes after brain injury and accommodations that you can use, tips and strategies. And then the fourth was on brain health. That next year, what we did is we took those first 3 topics and we made them case studies. So we gave you numerous cases in each of those topic areas to better explain. And people always say, "Well, how do I apply what you've just told me?" So that was an effort to do that. So you can look at those as well. And then this year, we're having on February 12th, and these are all free trainings, and you can get a certificate for attending these as well. We're going to have brain injury and co-occurring conditions. And that is the one that we did back in 2023, but it's going to be updated. It's going to be, if anybody's missed that one, they came later, you can come to that one and get it live. And then on February 26th, we'll finish up at least this round of series on brain health. And brain health is for anybody. If you have a brain, it's for you. So it's not just for the people that we serve, but it's also for us and our families. So come learn more. And that's all evidence-based as well. I want to share this with you. This is a video that we put together that it's 5 minutes and gives you an overview of brain injury related to the other systems. And I believe I shared sound, so Jen, just give me a thumbs up. Yes, go ahead, Jen.
Well, I'm going to jump in before the people who are so kind to be here today. Before you think maybe that you don't need to stay for the last few minutes, stay for our last parts of the meeting, because this video and the next one you might really want to see as something like an awesome takeaway to be able to, in a nutshell, tell somebody what Tennessee Brighter Futures was about, or to teach someone a little about brain injury that you learned in your time that you've attended our meetings or shared our information. So it'll go by quickly.
Just give me the thumbs up that you hear it.
All right.
Brain injury is bigger than you think. Brain injury is everywhere. It's part of our lives, whether we realize it or not. Can you believe that 1 in 5 people in the United States are living with a brain injury? For perspective, that's like the populations of California, Pennsylvania, and Florida combined. Brain injury affects people of all ages, from infants to teens, adults, and older adults. There are many different types of brain injuries. Most people think about traumatic brain injuries like falls and car accidents, but tumors and strokes can cause brain injury too. Some toxic substances like lead can damage the brain, so can a lack of oxygen from an overdose or near drowning. Brain infections and seizures can also cause brain injuries. Brain injuries everywhere. It has far-reaching consequences for families, communities, and society as a whole. Its impact reverberates in every major system. Did you know that 50% of people in our mental health system have a prior history of brain injury? Substance use treatment centers also have 50%. In fact, in centers that treat both mental health and substance use, 80% have a prior history of brain injury. In the adult criminal justice system, can you believe the number is 87%? For detained youth in the juvenile justice system, it's as high as 67%. Over 50% of people who are homeless or in an insecure living situation have had a traumatic brain injury. As many as 20 million women each year could have a TBI caused by domestic violence. One of the leading causes of physical abuse deaths in children under 5 in the U.S. is abuse of head trauma. About 60% of all people with TBI develop chronic pain. It's everywhere. It's a part of every major system that we as a society struggle with. Maybe you've already heard about ACEs, adverse childhood experiences. Did you know they can also overlap with brain injury? The toxic stress from ACEs exposure can alter brain development, and it can lead to changes that look like brain injury, like impulsivity, poor judgment, and being quick to anger. And those risky behaviors can increase the chances of having a traumatic brain injury. If you live in a rural area, you're at a higher risk of sustaining a brain injury. If you're a member of a racial or ethnic minority, you're more likely to sustain a TBI and have worse outcomes. Over 1 in 50 Americans 75 or older experience a TBI-related emergency department visit, hospitalization, or death. Veterans with TBI have higher rates of PTSD, substance use disorder, and anxiety disorder. In the disability community, over 5 million have a long-term disability from brain injury. But most of these systems aren't looking for brain injuries. They see the behaviors and problems they cause, but they don't realize it's because of the brain injury. The person knows they're having difficulty, but they don't know why. They know they've hurt their head in the past, but they may have never heard it called a brain injury. It would be a game changer for both survivor and professional in any system working with them to identify the injury. First, screen everyone entering the system for a history of brain injury. Use a symptom questionnaire to screen for cognitive and functional changes. Educate staff, the person, and their families about brain injury. Give them simple accommodations like using a planner to keep track of appointments or setting reminders on their phone. Refer them to any community resources like symptom specialists they might need. And then monitor them over time and help them understand what types of things to look out for. like pain, changes in mental health, or trouble with the law. So where can you go for more brain injury resources? BrainLinks has infographics for people working in each system about how brain injury overlaps and what they need to know. Then, this main infographic brings the bigger picture of brain injury and all of those systems together. Online, check out these 4 toolkits for various professionals and for survivors. On the website, select Have an Injury for more information. Contact us at tbi@tndisability.org. Not from Tennessee, you'll still want to check out our website and definitely the Brain Injury Association of America and NASHA. Brain injuries everywhere. It's best to be ready. Be ready with BrainLinks and Tennessee Brighter Futures.
Sorry, it was getting hung up a bit because we're on Zoom. I was taking a lot of bandwidth. So please go check it out on the YouTube, our YouTube channel. It's much smoother, and that was Jen's magical tone that you heard there.
Brain.
Wendy, this is Paula. I wanted to chime in again just to reiterate. When you look at it, just that last couple frames, there's the image of the United States, and they are all of those Post-it notes that make up all the systems that are part of Tennessee Brighter Futures, which is when you see that, that's part of you making an impact. So I just wanted to picture out, every time I look at that map with all the Post-it notes, I think of Wendy's butcher paper on her dining room table with all those Post-it notes all over it. So I just wanted to jump in and share that.
Thanks, Paula. There was also another product that was developed and disseminated, and that was Concussions Are Treatable. And that came out because of the research with the Rural Health Group. When they went, one of the pieces of research there says that people, especially in rural areas, don't know that concussions are treatable. And we know that people all over don't know that, but that came about from that. That's also one being used by other states, and it was also disseminated in 7,000 meals for seniors. So just an aside, know that concussions, we think of them as not big deals, but there is a lot of really good treatment that is symptom specific. That, let's say you're having a balance issue, someone will work with you on kind of retraining that part of your brain to help it to recover faster. And this is another thing. Before, when I said that we keep stumbling on things that we didn't know about that people were doing with our materials, this was one of them. We did not know Mary Beth Watson. We've since reached out to her and thanked her, but she put this on Facebook. She took our infographic and the promo language that we put out along with it, and she put it together into a video. So if you'll indulge me, I'll show you this. It's about a minute and a half. I've put the video on top of this. I've embedded it because we can't pull it directly from Facebook. So if you go to Facebook, you'll actually see all of the closed captioning on there.
Did you know that over 64 million people in the U.S. live with brain injury? Many may also face challenges like mental health, substance use, homelessness, chronic pain, domestic violence, adverse childhood experiences, child abuse, or justice system involvement. BrainLink's new brain injury infograph reveals how brain injury overlaps with 9 critical service systems and 5 social determinants of health: aging, disability, rural health, veteran health, and minority health. It's a must-see tool for professionals in healthcare, education, criminal justice, homelessness services, and more. Together, we can close the gap in care and improve outcomes across all systems of support. Whether you're a provider, a policymaker, or advocate, this powerful visual helps you understand how brain injuries often go unrecognized. See the link between brain injury and all systems of support. Learn what frontline staff can do: screen, accommodate, educate, and refer. Explore BrainLink's powerful infograph series revealing the hidden connections between brain injury and dozens of co-occurring conditions. BrainLink's mission is bringing together professionals to recognize the far-reaching and unique nature of brain injury and to improve services for survivors.
We were just
Did you know that
so tickled by that. So thrilled. So the focus of it was brain injury, but you also hear the mention of all of the other systems, all of you all too. So your word got out there as well across the state and beyond. Because of Tennessee Brighter Futures, BrainLinks was given an award. Again, we weren't looking for it. We didn't know about it. They found the program and they thought enough about it to give us an award. It had a monetary component, and that allowed us to begin working with Cumberland Heights, which is a very big private substance use program in Tennessee, and we trained them, and we were able to purchase the OBIS, the online brain injury screening and support system, and they have begun screening their folks, and it seems very surprised to see the number of people that are in their program that have a history of brain injury. And they're coming up with national numbers, which is about 50%. So we'll see where that goes. I won't go into the website, but on the BrainLinks website, you can find the Tennessee Brighter Futures information and all of the web pages that go along with that. So what you can do from here, from our perspective, our brain injury perspective, is start screening for a history of brain injury and for the functional problems that might arise from that injury, accommodate for any symptoms within your program, educate the staff, the person, and their family, and then refer if necessary. So please, if you are interested in doing that, please reach out to us. We would love to help you do that. Also, because of this program, we put together a brain injury and co-occurring conditions guide that helps to explain how it's kind of the same across each system, how you would implement a program in whatever system that was appropriate. And this will be up on our website soon. It's not there yet, but we will make sure we send out to you when it is there. And that's a good thing to read if you're thinking about starting a program. So we are just about done. I think I promised you 2 surveys. This is the impact survey. If you wouldn't mind taking this one real quick. They're both really fast. The second one is for the CEUs or the certificate. That's not this one. This one is like, just tell us about the program, any impact that it might have had on you, even if you've attended one meeting. That's great. We want to get your input.
That's in the chat now.
I was just going to say, I'm sure Jen or Paula, by the end, we're a well-oiled machine and you know what's going on in the background. So yeah, please do that. And then I'm stalling here, give you a moment to at least pull it up. And then while you're doing that, we'll just reiterate to please continue to use the resources. If you think of it, tell us how you've used them. If you need our information on what are some of the outcomes of this program because you're part of a grant program, then reach out to us and we'll get that to you. But please keep on using the resources. Let us know if you do develop any other resources that are cross systems that maybe they focus more on your system. Let us know that, and we will help to distribute those as well and get them out to the network. That one thing that we learned from this is that network is just extremely powerful, and we're kind of sad that we won't be meeting every other month to be able to continue that relationship. So I'll let you take this survey if you need a certificate of attendance. If you don't have to bother taking this one. This just lets us know that you were here and to give you that certificate that will come to your email. So I'll give you a minute to do that. And then in closing, I just want to say, we all want to say again, thank you, because we have all had a much bigger impact than we could ever have had alone. All of us working together at helping our folks, because we're not the only ones that have people with co-occurring conditions, but not just this one thing. You all do as well. So the more we can help each other, support each other, spread the word about anything that's come up in your area, the better off we all are. And in addition to that, thank you. We just want to say, don't be a stranger. Please reach out to us for any and all things brain injury. And if we can't help you with it, we can help you get to the person who can help you with it. So again, thank you. Thank you.